other limitation that's going to be imposed on health insurance companies is that they will no longer be allowed to rescind coverage unless the enrollee has committed fraud or made a material misrepresentation of fact. So again, that's going to bring more people into coverage than previously was the case.
You know, one of the other things in 2011 is the health HSA or FSA accounts, flexible spending accounts. There's a penalty, currently a 10% penalty if you pull funds out for non-qualified. That's going to go up to 20%. So, additionally, there will be a reporting requirement to report on employees' W-2s the value of the medical insurance that's paid on their behalf.
Clinton, I'm curious. I understand that starting in 2018, certain health insurance benefits will be taxed as income. If that doesn't happen until 2018, do you know why the W-2 reporting is happening in 2011? Just to get us used to it?
Just to get you used to it would be my guess. You know, I mean, I really can't think of a reason why you would require people to start this disclosure other than to get them used to it, to make sure that when that happens in 2018 that there's compliance, because obviously the government's looking at it as it's going to be a revenue source for them. I think the other thing is I think it's important to employees to know that their compensation is more than just their wage. You know, employers spend a lot of money on benefits, as you all know, spend a lot of money on benefits, and I think sometimes employees don't have an appreciation for that. I think it also, though, starts to set up this issue, at least for the small employers, that if, after the tax credit goes away, that reporting is going to go away, too, if they no longer provide health insurance. So it's kind of strong-arming, if you ask me. It's strong-arming small companies, and it's making sure large companies are in compliance when that does become taxable.
A couple of other things relative to 2011. There is a provision that requires employers that have more than 200 employees to auto-enroll their employees in their health insurance plan. So that'll be something new. It'll change the view a little bit of how employers and employees are interacting relative to health plan enrollment. Now, it does still give the employee the right to opt out of the health plan, but it's a different process that will be in place. Now, we think it's 2011, and for most plans it probably will be, but the Secretary of Labor has to issue implementation rules for auto-enroll, so it depends on when those rules are issued. If you happen to be a plan anniversary in the fourth quarter of 2010, and those rules are issued soon, you could then end up having to comply with that in 2010. Clinton mentioned and Terry mentioned the W-2 reporting requirement. In addition to the increase in the penalty for non-qualified withdrawals for FSAs, HRAs, HSAs, another big one is the over-the-counter medications, which are no longer going to be eligible for reimbursement. And one of the challenges with that is, again, if your plan anniversary is not January 1, when we talk about the regulations under the umbrella of the IRS, under the 125 plans, those are tax year, calendar year based. And so there are a couple of provisions as we go through this timeline that are going to require additional guidance and thought on the part of employers, because the change will take place January 1 of that tax year, not on your plan anniversary as most of the health plan provisions take place. So a little different thought perspective there. Something else that's part of 2011 is there will be some funds appropriated in 2011 for wellness grants for small employers to help them implement wellness programs for their employees. There'll also be some simplification under what's called simple cafeteria plan rules for small employers with fewer than 100 employees to make it a little bit easier to administer cafeteria plans for small employers. So that's something else that's happening in 2011.
One other thing that happens in 2011 is the CLASS Act, C-L-A-S-S. This is a program for providing coverage to employees for their long-term care needs. If one of your employees ended up in a nursing home or an assisted living facility, this coverage would take care of it. It's a little different from most employee benefits. You know, we're all used to saying, okay, here's our list of employee benefits, pick which ones you want, and the employee's free to decide. This one says, on January 1 of 2011, employers shall begin deductions for this program unless the employee affirmatively opts out. So if you want to do that, you need to have your paperwork in place prior to that effective date, or else you'll be required to start withholding for their long-term care. Probably you have some 25-year-old employees who aren't too concerned about that, and they probably don't want to have that deducted.